Hi again, Shrikant.
Hi, Charlie. Welcome back.
Thank you. As homeopaths, we talk a lot about the fact that homeopathy can treat anything, pretty much. But when it comes to a serious diagnosis like cancer, is there a different approach that you would take with homeopathy compared to other cases, please?
Charlie, the principles remain the same of trying to find a remedy which matches the physical, mental, emotional makeup and the genetic makeup of the patient. But what varies in the treatment is that uh, because of the depth of pathology, because of the aggressiveness of the pathology, you may need to sort of be much more careful with uh, repetition of doses. I must say this, that, um, there is a common perception that homeopathic medicines don't have side effects. So it is okay to repeat medicines as and when you want, take 2-3 medicine at a time, repeat many times, etc. But if you are giving the right remedy to the patient, the what in some ways we call it as the similimum, the exact fit for the patient's symptom, you will see that just one dose is more than enough. Even in a pathology like cancer, I see that I give one dose and I wait for 15, 20, 30 days, 1 month, 1.5 months, sometimes 2, 3 months. I don't have to repeat the dose. In fact, I must say that sometimes out of my own sort of impatience or wanting to get more quicker results, or patients wanting, oh, it's been so many days, you have not given me anything and I am suffering from such big disease, you should give me something. Out of all these feelings, no, I have repeated doses. And I've seen that the patient deteriorates. Patient was doing much well, and then out of all this, I've repeated and the case gets spoiled. And then it takes a long time to get everything back on track. So this is very important. The approach does not differ in selection of remedy, but the approach definitely differs and becomes much more sort of precise and sharp as to when to repeat, how much to repeat. This becomes very important. In a smaller illnesses, even if you give 2-3 doses extra, patients may have some symptoms for a day or two and then they pass away. But in a pathology, if you give 2 or 3 doses extra, it is going to flare up and it's going to create a havoc for the patient. That is the main difference, if you ask me, between treating any other pathology and cancer or any other deep pathology. Superficial pathology, it's okay even if you repeat a dose here and there, nothing happens. But deep pathologies, even single dose can spoil the whole case. So the posology is what is different when it comes to, or rather than different, I'll say it is much more careful, much more cautious when you're treating pathology. That is the main difference.
I think that commonly if people are using homeopathic remedies at home and they're using 30C, 200C to treat common illnesses, coughs, colds, things like that, it can be quite difficult to think, if I took arsenicum 200C because I had a really bad flu, and then that same remedy in one dose could help stop the spread of cancer. It's a difficult thing sometimes to get your head round. Do you think?
Yeah. Yes. So what we need to sort of remember is this, that patients should know how homeopathic remedies are prepared. And suppose you take 30C. 30C potency is like 3000 drops of alcohol, and in that you have put half, or not even half, less than 10% of a drop of arsenic album. So you see how much it is ultra diluted. No, even that amount of ultra dilution is acting on the patient. No. So why is this happening? Because you are ultra sensitive. If I am not arsenic album, and if you give me arsenic album, many times you'll see nothing happens, because I am not sensitive to it. And because the remedy is in such huge dilution, it does not touch me. But when I'm sensitive to it, even not 30, even 1 potency or 10 potency, that creates havoc, that creates a lot of symptoms. That is because I am susceptible to it. I am too sensitive to it, because that is my remedy. So that is what is happening. Many patients, they feel, till yesterday I was taking this remedy, nothing would happen. This doctor suddenly is saying that you take 1 dose, oh, you'll have symptoms. How is this? Patients say, let me take this also, that also, let's try, etc. But the point is, if you get the remedy, the correct remedy, then even a small dose of it is good enough to treat any pathology. That is what is the difference.
Okay. So that's the main difference between first aid prescribing and proper constitutional prescribing, is just the fit of the remedy, nothing else.
Correct.
Understood. Thank you very much.
Welcome.